So good afternoon to everybody. Welcome to the second session on our meeting on sharing of South-South experience among countries along the Belt and Road Initiative. It is indeed a great pleasure for me having the possibility of chairing this panel on the key policy responses to the pandemic in developing countries. And indeed is pretty evocative and somehow auspicious doing this for the first time after a long while here physically in presence in the Palais rather than through the screen of my laptop as I was doing since the beginning of this pandemic. We launched our initiative on enhancing structural transformation on key partners of the BRI before the COVID-19 hit the world economy. We were aiming at that time at drawing policy lessons from the very successful Chinese policy experience and tailoring those lessons to local conditions and idiosyncratic challenges. In a global scenario, as we know, we discussed this this morning with Richard and with our Secretary General, which was at time, as still it is, unfortunately, packed with constraints to policy action, which were streamed in a web of trade and investment agreements. That was basically, and that is basically, the multilateral trade architecture we live in. And this web of agreements and constraints to policy action were somehow reflecting, as they do reflect, a dominant vision, which is a strongly market-centered vision of the global economy. This difficult and somehow developmental-friendly scenario has been discussed and denounced through our series on trade and development reports across the years, and I guess that many of you, both in the room and connected elsewhere, are familiar with our work in that direction. Now, the limits of the market-led model and the multiple fragilities of the global economy have been dramatically exposed, as we all know, during the pandemic. And as it is often the case in critical historical juncture, this is also the emergency, apart from the negative side of it, is also opening a window of opportunity to change the thing and to change the way in which we organize the global economy and our society. The economic responses to COVID-19, in fact, essentially the rescue from a crisis which could have been worse than the Great Depression, came by ripping out the dominant economic rulebook and changing somehow, not respecting the rules of that Washington consensus, which has been central to the ruling of the global economy in the last 4 decades. In this context, our work on policy lessons becomes more relevant, and the space for policy maneuvering grows. It is important, we believe, not to leave this important opportunity unmet. And that is why I think that we have been using our best efforts along the last couple of years to examine policy responses to the pandemic, both at the national level, at the regional level, and at the global level. And we have been proposing options, line of actions, institutional reforms to try to overcome the current difficulties, the crisis which somehow followed and for some developing countries even predated the health emergency, while at the same time using the opportunity to place once and for all the global economy on a more resilient growth path, able also to combat the rising global temperature and ensure what we all try to do at United Nations, a more prosperous future for all of us. Our contribution in this respect range from purely macroeconomic and debt policy to trade and industrial policy and to governance reforms able to relaunch South-South and regional cooperation. This was mentioned both by Richard and the Secretary General this morning, is really in the courts of our organization since the incept in the mid-60s. We have also been working closely with many developing countries in South America, in Southern Africa, Asia, and Latin America, and especially, of course, with the partners of the Belt and Road Initiative. It is now time to discuss and compare these country experiences and highlight what was working well in this country and what instead should not be repeated, because we truly believe that mistakes and failure along a learning curve can teach us as much as fixes and successes. Today, as we know, we will focus on 4 countries: China, Ethiopia, South Africa, and Malaysia. Countries which are very different in terms of size, demography, geography, level of development, and that adopted different policies in responses to health and economic emergency. We hope that this session could therefore offer a complete picture of how the developing world responded to the pandemic, thus providing the practitioners and the policymakers a full spectrum, a spectrum as ample as possible to face the present and future challenges. Before leaving the floor, I guess, to His Excellency the Ambassador Matujoini from South Africa, who is honoring us today with his presence to deliver a keynote address, maybe I can leave the floor to Director of Division Richard for a few introductory remarks.
Thank you, Pepe, and welcome to the Ambassador. and thanks for making some remarks. I mean, this is a very topical and timely session, I think, and so timely that I won't be able to stay, unfortunately, because I'm in the middle of trying to finish our update of the Trade and Development Report on the current state of the global economy. And we're not yet in a post-pandemic world. I think it's important to say that. The pandemic is still with us, so we're not in a post-pandemic world. And the challenges that posed to us were issues that we talked about already over the last 2 years in the Trade and Development Report, complicated now by the conflict, obviously further complicated by the conflict that is happening in Eastern Europe, and you know, UNCTAD will obviously point to the damage that this will cause to developing countries. Again, an external shock that they have nothing to do with, but will suffer the consequences, and point to the weaknesses of the multilateral system that is not responding properly to this kind of shock. I think one of the points to keep in mind, and again, it's a point that we've been trying to insist on in our work, is the idea, and I think this is why your discussions today are important, that we cannot go back. If we want to build a more resilient world, if we want to build a more sustainable and inclusive world, we cannot go back to business as usual. The world economy coming out of the global financial crisis itself was not in a very healthy state. The world economy in 2019 was in a weak state. We warned about the danger of a lost decade in the 2020s, even before the pandemic and even before the conflict. And that threat of a lost decade for developing countries is a warning that we will continue to make. The need for reforms of the multilateral system that requires, but also I think the need for policy changes in the South, and again this issue of sharing lessons, sharing experiences, that I think is the forte of the work that we've been doing in this project. So I think we have a lot. I hope we have a lot to discuss in this session. Unfortunately, I won't be able to participate with you. I should say that our work with South Africa on this has been particularly important. We've had over the last 2 years in other projects important work on structural transformation in Southern Africa, and the role of South Africa in particular in that story has been important to our understanding of fashioning of alternative policies at the national and the regional level. And so we want to thank South Africa for engaging with us on these topics, because I do think they're particularly important. So let me just wish you all, again, a fruitful discussion, and I'm happy to give the floor to the ambassador to hear his remarks on these issues. Thank you.
Well, thanks very much for your introduction, and apologies for my late arrival. I just got stuck in other meetings, and of course the traffic in Geneva just worsened my situation. But thanks, I appreciate this opportunity to share perspectives on how South Africa has responded to the COVID-19 pandemic. Indeed, this engagement is very much timely, particularly as we take tentative steps towards what hopefully is a post-COVID world. The outbreak and rapid spread of the COVID-19 pandemic has had a particularly devastating effect on the economies of countries of the global south, and South Africa is not an exception in this regard. The pandemic has led to rising levels of hunger, poverty, and significantly exacerbated pre-existing inequalities. South Africa recorded its first case of imported COVID-19 on the 5th of March, 2020. The pandemic made landfall at a time when the economy had been challenged with prolonged slow economic growth and a series of credit rating downgrades. The COVID-19 pandemic has had a dramatic impact on the population as it affected the way people live, the way they work, and the way they interact with each other. In response to this unprecedented, dreadful virus, His Excellency President Cyril Ramaphosa declared a national state of disaster and established the National COVID-19 Command Council, the NCCC, to take government-wide decisions concerning COVID-19 mitigation measures. This NCCC is chaired by the President and is composed of selected ministries, namely Health, Social Development, and Local Government and Traditional Affairs. Having established an incident management system and an incident management team, the IMT, in January 2020, as well as the NCCC, which I've referred to, South Africa had plans in place to contain the spread of the virus. The purpose of an incident management system and team is to establish a structured approach for managing a public health emergency by integrating existing healthcare functions into an emergency management model. 5 essential functions are described in an incident management system, namely management, operations, planning, logistics, and finance and administration. South Africa's IMT was further organized into key functional areas comprising governance and leadership, medical supplies, port health and environmental health, epidemiology and response, facility readiness and case management, emergency medical services, information systems, risk communication and community engagement, and occupational health and safety and human resources. 22 days after the first lockdown, after the first COVID-19 case was reported, South Africa went into a national lockdown. The national lockdown at risk-adjusted level 5 was in place for just over a month, after which the alert level 4 was introduced. Changes in the levels were related to the number of active cases as well as the capacity of the health system to respond in terms of the availability of beds to treat patients. Alert level 3 was introduced on 1 June 2020, after which the number of COVID cases started to rapidly rise until the daily new cases peaked around the middle of July 2020. The counterintuitive nature of adjusting to level 3 as COVID-19 cases were rising is attributed to the balancing act between the public health risks associated with COVID-19 on the one hand, and the need to restart the economy to protect the livelihoods of the most vulnerable populations. Despite early interventions initiated to curb the spread of COVID-19 in South Africa, an exponential increase in COVID-19 cases was experienced. It is speculated that the rapid rise in infections was due to poor adherence to isolation and quarantine guidelines, and to non-pharmaceutical interventions and socio-economic factors, such as, for example, areas which are densely populated and households that also have got high levels of density and lack access to clean water in each household in some areas. In the absence of a widely available vaccine to prevent the rapid spread of the virus, the importance of non-pharmaceutical interventions has been emphasized globally. In our national plan for COVID-19 health response, 9 strategic priorities were identified, and these are to provide effective governance and leadership, to strengthen surveillance and strategic information, to augment the health system's readiness, including emergency medical services, to enhance community engagement, to improve laboratory capacity and testing, to clarify care pathways, to scale up infection prevention and control measures, and last but not least, to boost the capacity at ports of entry. Finally, to expedite research and introduction of therapeutics, diagnostics, and vaccines. Of these strategies, the challenges and lessons learned in 5 areas were namely active and informed use of epidemiological data, community engagement and risk communication, the risk-adjusted strategy, capacity building and contact tracing, and community screening. It should be noted that this is not an exhaustive list of the strategies that were employed by South Africa in its fight against COVID-19. These strategies were, however, identified as having the greatest impact in impeding the rapid spread of the virus. The South African COVID-19 mitigation strategy is an adaptation of the World Health Organization COVID-19 strategy for containing and mitigating the spread of the virus, and is implemented by the Department of Health. Like many other countries in the world, South Africa introduced international travel restrictions to high-risk countries. This included monitoring measures of the travelers into and outside of the borders of South Africa. As regards to access to COVID-19 vaccines, the government in South Africa is the source, the distributor, and overseer of all the rollout of vaccines. The government, as the sole purchaser of vaccines, distributes these to provincial governments and the private sector. A national register for COVID-19 vaccines has been established. The vaccination system is based on a pre-vaccination registration and appointment system. All those vaccinated are placed on a national register and provided with a vaccination card. The vaccination certification system is only accessible to the individuals who have received the COVID-19 vaccines. In order to alleviate the human suffering and cushion, particularly the small and medium enterprises who have been the worst ravaged by the pandemic, the government introduced a series of intervention measures, namely a special COVID-19 social relief of distress, an amount of 350 rands per month. A criterion was for South African citizens, permanent residents, or refugees registered with the Home Affairs Department. And it's important to note that our vaccination strategy and broadly our COVID-19 strategy integrates all those who are within the borders of our country, irrespective of their nationality. We also introduced a social relief of distress, SRD, in the form of food parcels as a temporary provision of assistance intended for persons in such dire need that they are unable to meet their or their family's most basic needs. The SRD, again, is paid not only to South Africans, but to all permanent residents and refugees who have insufficient means. We also strengthened the Occupational Health and Safety Act that requires the employer to provide and maintain, as far as is reasonably practical, a working environment that is safe and without risks to the health of workers, and to take such steps as may be practically necessary to eliminate or mitigate the hazard of potential infections. We introduced a debt relief finance scheme for small and medium businesses which are negatively affected, directly or indirectly, due to the coronavirus pandemic. This facility is a soft loan facility aimed at assisting SMEs to keep them afloat during the period of the pandemic, and it has been implemented with a great deal of success and relief for SMEs. The government also introduced a tax subsidy to employers of up to 500 rands per month for the next 4 months for those private sector employees earning below an amount of 6,500 under the employment tax incentive. This has helped over 5 million workers. An unemployment insurance fund, coronavirus COVID-19 relief benefit, was also introduced. The unemployment insurance fund is contributing to businesses that are unable to pay salaries because of the lockdown and would have to access the fund to pay salaries to employees. And finally, in the education sector, our government has provided free data to all education institutions, from basic education to higher education, for both learners and teachers. The strengthened command and control, centralized measures that were implemented have enabled swift evidence-based decision-making. The timely and technologically innovative contact tracing and large-scale community screening and testing were beneficial in quickly detecting hotspots and mitigating further spreads. Public and private sector collaborations enabled efficient capacity scale-up in some areas. The provision of isolation and quarantine facilities and the freeing up of hospital beds for patients with COVID-19 enabled the provision of surge capacity. The ministerial advisory committees comprising of the various subject matters also provided the Minister of Health with evidence-based advice on managing the pandemic. While the early stringent lockdown provided South Africa with valuable time to increase healthcare capacity, it has also resulted in economic hardships, particularly for the most vulnerable populations. Another important lesson learned was the need for continuous oversight and accountability among leaders and the need for strong governance systems to avoid corruption. Taking into account the challenges and the experiences that we have gone through and the lessons learned during the first surge of the COVID-19 cases in South Africa, improvements in the future will focus on the development of a more agile and targeted approach to risk communication and community management, rapidly rolling out community screening and contact tracing, coupled with educational material covering the importance of these interventions, the implementation of more effective enforcement strategies covering the enforcement of social distancing, hand hygiene, and the proper use of masks, increasing public and private sector cooperation, implementing an electronic medical record and single information systems for the healthcare sector, and allocating more finances to the development and hiring of human resources for the health sector. It is indeed vital that these lessons that are learned are leveraged to improve the public health response in the future. The pandemic has taught us to invest more in the health sector. Indeed, it has exposed the weaknesses and disadvantages of the current global production system, which is concentrated in developed regions and countries of the world, as well as the vulnerabilities of the global supply chain system. This has taught us that we must strengthen the multilateral system to better respond to emergencies in a timely and equitable manner. For most of 2021, limited global vaccine supply led to huge disparities in COVID-19 vaccines access, leaving billions of people, especially in low and middle income countries, unprotected against serious disease and death from COVID-19. Low levels of vaccine coverage also provided the ideal conditions for new variants to develop. While supply has now increased, access to any new formulations of COVID-19 vaccines, tailored specifically to new variants, will likely also be inequitable because manufacturing capacity remains limited to only a small handful of companies and countries. COVID-19 has therefore demonstrated the importance of investment in science, technology, and innovation. Therefore, preparing for future pandemics is key. And so the WHO mRNA Global Hub is a critical building block to ensure that South Africa and the whole continent has the production capacity that is essential for equitable vaccine rollout. We are indeed happy that we've been designated, and indeed we've established this hub in South Africa in Cape Town. The mRNA technology is not only for COVID-19. We hope it can be adapted to help us in the fight against HIV/AIDS, tuberculosis, and malaria, another set of burdens of diseases that are killing people in developing countries and specifically in Africa. And this is why we're investing heavily alongside international partners in this initiative. As part of the process of building the capacity of developing countries, technology transfers should be enabled through a TRIPS waiver in the WTO, covering copyright, industrial designs, patents, and protection of undisclosed information. This will facilitate global access to COVID vaccines, medicines, and diagnostics, and indeed ramp up manufacturing and production to supply all countries on an equitable basis so that no one is left behind. Last month, the WHO announced the first 6 countries chosen to receive the tools needed to produce the messenger RNA vaccines in Africa, namely Egypt, Kenya, Nigeria, Senegal, South Africa, and Tunisia. And of course, South Africa is the hub, and the rest of the countries will act as the spokes. These countries will receive training and technical know-how on how to produce this type of vaccine from the global mRNA technology transfer in the Cape Town hub, which was established last year with the aim of ramping up this type of vaccine manufacturing in low and middle income countries. International solidarity and cooperation instead of narrow nationalism and protectionism is essential. We welcome the decision of the Special World Assembly that convened here in Geneva last November to establish an intergovernmental negotiating body to consider a treaty on pandemic preparedness and response. We believe that such an initiative should be legally binding, and it should help us to better prepare for the next pandemic. Finally, After an initial period of stigmatization characterized by travel bans, South Africa was lauded by the UN, by the WHO, by the AU, indeed the entire international community, for the groundbreaking work done by its scientists in quickly identifying the latest coronavirus variant, Omicron, and sharing this information with the world. The transparency displayed by the South African government in sharing this information should serve as a model for the world going forward. I thank you for your attention.
Ambassador, thank you very much. And I should add, of course, that South Africa, along with India, has been playing a pivotal role in the WTO in calling for a TRIPS waiver on relevant vaccines and other medical goods. It's an ongoing struggle. It's a sad reflection, I think, of the state of the multilateral system that it has resisted that so far. But it has been a tremendous effort by the government of South Africa in that respect. So, and we work closely with your colleagues, of course, to try and advance that agenda. So thank you very much for that. I'm going to hand over to Pepe now. As I said, I have to get back to my day job of trying to finish the latest report that we will come out with on the state of the global economy and the challenges that the South faces. But I think this is a tremendously important topic that we need to share lessons and learn from each other's experiences, including the detailed lessons that the ambassador identified in the context of the South African response. So I think there's a lot to discuss around this issue. So Pepe, I'm going to give the floor to you. Thanks.
Thank you very much, Richard. Thank you for being here and introducing the topic of today. And thank you very much, Ambassador, for a fascinating, I would say, intervention. You've been touching a lot of critical points. And I think when we go on vaccine, there is one statement that Tedros, the Director General of WHO, made a few weeks ago and described the vaccine challenge as one of the greatest success for science and at the same time a great failure for humanity, because the way in which this vaccine has been developed in record time, but then distributed in incredible unequal way, it's one thing that is calling for change and calling for action. And I guess the ambassador, what has been doing today has been, within other things, sketching how we should work in this direction. And I got to say, I completely agree. The idea what South Africa is doing, on the one hand, acting on the global governance agenda. The TRIPS waiver, the Richard was mentioning, and you mentioned, of course, the Treaty on Pandemic Preparedness in the framework of the Global Health Assembly, while at the same time moving and strengthening South-South cooperation. And the mRNA hub for development and transfer of technology to low and middle income countries, I think is a fantastic example of what in the future this South-South cooperation should resemble. So again, thank you very much for being here and sharing this experience and sharing with us an inspiring vision, His Excellency. So without further ado, I'm happy now to introduce to you our next speaker of today, which is In Xiaolong, who is joining us traveling from Malaysia, and is working as a research associate in the Kazan Research Institute. He has vast experience in trade policy, in industrial policy, in climate policy as well, which is, again, after the pandemic, we have other crises looming us. We should not forget that climate is there behind the corner, unfortunately. And he is also recently served for the Technical Committee of Malaysia National Vaccine Development Road. So he has peculiar and vast regard on what has been the crisis, but the economic emergency and the health emergency we've been discussing. So I'm very happy to leave you the floor to guide us on the Malaysia case study. Thank you very much, Xiaolong, for joining us.
Thank you very much. Thank you to UNCTAD for inviting me here to share experiences and to participate in the project. I think it's been tremendously useful as well as painful to go over the recent history of the pandemic. I think one of the interesting lessons and challenges from documenting the policy response to the pandemic is how quickly assumptions and realities have changed even in a matter of months, and how, also worryingly as a researcher, how documenting the first phase of the pandemic up to April 2021 already feels somewhat dated. I have tried my best to make some general and somewhat longer-lasting conclusions from it, and I just share them with you now from the Malaysia case. The Malaysian case is particularly interesting as a national response because for most countries, the response to the pandemic was a mix of a public health crisis, which required a shutdown of the economy, which then provoked an economic supply crisis, a supply shock. Malaysia had an additional complication in 2020. We had a triple crisis because we also had a political upheaval. Within about, our first lockdown was declared on March 18th, 2020. I know the day well because it's my birthday, so it was an unforgettable birthday present. But just about 3 weeks before, the new government, which had come into place in 2018, the Pakatan Harapan government, had collapsed. It's significant because Malaysia, the political change in 2018 was a bit like the fall of the Congress Party in India or the downfall of the Kuomintang in Taiwan. This was the long, multi-decadal independence party, the Grand Old Party. It ruled for about 6 decades in Malaysia, and then it collapsed amidst scandal and crisis. And then it had been replaced by an opposition coalition that included some former members of the previous government. And so it came in with a reform agenda, and for full disclosure, I served in that government as well. But the previous government that had been, members of the previous government that had been deposed, found a way back in through a series of political defections and crossovers. So all that intrigue happened 3 weeks before the pandemic. And one of the consequences was when the lockdown was first declared on March 18th, the cabinet had just been sworn in 8 days before. So we had a Minister of Finance and a Minister of Health, these two key policy positions, who'd never previously been ministers before. The Minister of Finance was a commercial banker previously. So they had a total of 8 days working experience as ministers in the job. And that is how Malaysia entered the pandemic. Now, that's not to say that the civil service didn't know anything. In fact, to our great benefit, the health service had been quite prepared for a pandemic before due to previous experiences with the SARS virus and also the Nipah virus, which was also a zoonotic disease. And our national vaccine production actually had been developed quite well in terms of animal vaccine production in response to the Nipah virus coming out from livestock. So the government knew what to do, and they were advised by the Director General of Health to declare a full lockdown in response to the pandemic, which the new government made the bold decision to do so. And so we entered a lockdown that lasted several months. It was tough, but it was successful in terms of flattening that first curve, right? I think if you remember Thomas Puyo, who read that very famous article on the hammer and the dance, those kind of two abstract metaphors relate to the hammer being a very sharp lockdown to restrict the transmission of the virus amongst humans, but of course that affects economic activity. Then the dance would really be this kind of very agile development of responses that would follow the particular nature of this kind of novel virus, the tracking, the tracing that's required that the South African ambassador spoke of. Part of Malaysia's challenge was the public health service, while it was well versed in these kind of WHO protocols, had been underfunded for decades. So while we were able to declare a very sharp hammer blow to stop the transmission, we quickly faced limits in terms of extending the capacity, particularly the human capacity, to do the manual work of contact tracing, tracking who went where and who talked to who and so forth, particularly with religious clusters, which were some of our early big clusters, and also led to Brunei's first case as well within the region. It was very hard to bring technology to bear, to bring further human resources to bear, to keep that dance up to catch up with the nature of the virus. So that's where the public health system began to hit its limits in the sort of second 6 months of the pandemic. The political instability also didn't help, because we'd had 4 governments in as many years in Malaysia, quite unprecedented for the country, which was sort of quite famous for political stability. And one of the consequences of the new governments there was that they had a very fragile and unclear majority, which the economists quite wittily referred to as Schrodinger's majority. It was not able to be tested in Parliament, so you could never really tell quite how many people supported the government and whether there was a clear majority or not. And one of the ways to prevent it being tested in government was to declare a state of emergency that suspended Parliament. So we had it all in 1 year. And quite a fair, about half of the first period of the pandemic was governed by emergency legislation, by fiat and not by Parliament. Of course, we have returned to normalcy since about August, July, August last year, and Parliament is functioning once again. But one of the other challenges is also because we had a new government with very few experienced ministers. The reins of government, for a new minister, typically it takes at least a year in the job to understand how to pull the levers of the civil service and the orders of command. The benefit was that the Prime Minister at the time had previously served in several governments as well and held many ministerial posts. But the challenge, I think, common to many governments around the world was that while the pandemic was revealed to us by science, policy ultimately wasn't sufficiently science-driven. There's been a long debate about what is the nature of the virus transmission. Is it by droplets, large droplets that are best inhibited by, say, barriers or masks, or is it, does it function primarily as aerosol transmission? In which case, ventilation and the physics of small particles becomes very important. Unfortunately, the WHO has made a very conclusive statement on that, and so it's also held back the policy response in many countries, including Malaysia, where ventilation remains largely optional, although we've maintained mask mandates, and we've gone very full in on vaccination, which I'll touch on later. As for the economy, so with a fairly new finance minister, but we still had a fairly experienced finance ministry, the policy response defaulted to pre-pandemic approaches, which was namely to continue to stress the desire to pursue fiscal consolidation, particularly in light of the aftermath of the 1MDB financial scandal that had deposed the previous government. So there's a very great need to appear to want to consolidate debt. And the IMF, of course, had quite a strong influence on the thinking of the Treasury. And even though the IMF had previously said at the beginning of the pandemic, go large, dig deep, take on credit, the Treasury was very reluctant to do so. And they were very, very worried about credit ratings. The credit ratings did drop, but ultimately they were the penalty applied in the credit ratings was not for the fiscal measures, it was actually for the political instability and uncertainty. And that was evidenced by continuing intrigue to topple that new government, and eventually it was, and there were various state elections held as they tried to do a domino effect to get a kind of sweeping political shift back in the country. And one of those state elections precipitated in the state of Sabah in sort of September 2020, actually generated the third wave in the country because they dropped a lot of health restrictions in order to permit people to go back and vote. And so despite the initial successful lockdown, those gains were erased by the kind of political events that happened. Controversially as well, the economic relief measures, and there were about 9 packages done over the course of about 18 months, sort of piecemeal measures, often lagging behind announcements of further lockdowns, and there were about at least 3 major lockdowns with multiple state-level lockdowns as well. It became quite confusing and quite frustrating for businesses to predict how long do we have to shut down, how much cash flow do we need to maintain. So the consequence was that many SMEs shut down. We lost about 150,000 SMEs, amounting to about 1.2 million jobs during that time. Even though aid packages were made available, at least a third of SMEs didn't know or couldn't access the aid packages. Aid packages that were made available in terms of like food baskets for the bottom 40 percentile of households, it was found And to their credit, the Ministry of Finance attempted to assess to what degree aid reached the ground. They found that 19% of the poorest households didn't receive the aid packages, actually. So despite Malaysia's fairly advanced bureaucracy and experience, when the system was tested in the short term with this kind of shock and crisis, it would still struggle to really deliver aid, not just to the formal sector, but also to the informal population as well. So there are a lot of lessons there, but there hasn't really been a strong policy debate about how do we really ensure that we close the gap to ensure that in the future we actually reach the people who need the aid most. Controversially as well, in terms of the economic measures, because of the fear of tapping into more debt, one of the emergency measures undertaken by the government was to, in an unprecedented move, allow the private households to tap into their pension funds. Normally, people are not allowed to withdraw those funds, and because the government wants to, sort of act as a more responsible adult for them. But people were allowed to deplete them for paying off immediate short-term needs and costs, with the result that I think close to like 45% of private pension holders have depleted their accounts to zero. We already had a retirement crisis in the country before the pandemic, but what the pandemic has done is that it's accelerated it for the poorest households. There's now a debate about whether to raise the retirement age by a further 5 years, because that's just how much of the depletion has happened. But of course, we know that's not an easy thing to do. Many issues come up, including pressure on the younger employment cohorts and so forth. And the other measure that was done, and this relates to vaccines actually, and this is it's a mixed success in a sense. So despite the adherence to IMF orthodoxy, the government still found ways to get and release some money in order to finance a vaccine purchase program. And to be fair, we know many countries couldn't afford to get vaccines, but Malaysia found a way, and that was primarily by tapping into our national trust fund, which was to date being financed almost entirely from our petroleum revenues, right? Because we're an oil and gas producing country. This is only the second time that the National Trust Fund has been used. And so far it has been tapped twice to finance the national vaccine program, which has been successful in vaccinating 80% of the population with 2 doses. And now, at least since January this year, we've started a vaccination program for under 12s, and also have been able to afford and secure supply for a booster program. The uptake on these latter 2 has been a bit slower, partly because of some cultural suspicions and people, getting a little bit inured to the pandemic now. But you can see the positive effect with Omicron, right? Because Omicron, in the last week or so, cases have breached 30,000 per day, but hospitalizations have remained low, and fatalities, thankfully, have remained, I think, double-digit at best. So the vaccination program has helped to blunt the edge. But of course, we know we can't rely entirely on vaccination. We have non-pharmaceutical interventions like ventilation that still need to be really taken full advantage of. But to give the government credit, when the scramble came to find money, they found the money, yeah? Now, the economic relief measures blunted inflation and more severe economic shock, but they were often too little, too late. They tended to lag behind shutdowns of the economy. So there were periods where businesses just couldn't operate with no access to funds and financing, and therefore found it hard to keep people on the payroll. But the economy also remains facing a struggle to recover. Why? Well, we took about 10 years or so to recover from the global financial crisis. And the rate of growth and the trajectory of growth only recovered to pre-GFC levels around the time the pandemic hit. So it's taken a double blow. And it's really strained the capacity of the policy to really find sources of growth and industrial policy that will not only, get us out of so-called middle income problems, but also to overcome the structural problems of the pandemic. So some lessons I think we can draw from the Malaysia case, and I want to stress that we've been able to ride the tiger that is the pandemic, but we have been quite badly scratched in the process. we have developed an ambition to manufacture human vaccines, but largely we want to do it nationally. I think there's a case to be made for doing it regionally within Southeast Asia, because some things like duplicating high-level sterile labs are not easily done. Thailand, for example, already has like level 4, level 5 labs. They've been able to get the contract for AstraZeneca, for example. Is it worthwhile Malaysia trying to duplicate that level of capability, or to work out some regional production? I'd like to focus on lesson 2 here, because it's an important one also when it comes to the other crisis, the climate crisis. I think as someone who works on climate change as well, the pandemic has been a very familiar situation where, scientists and other experts are telling policymakers, this is the science and this is what the science tells you to do. But then we see the policymakers selectively pick from the science in terms of translating to policy action. So the pandemic is a very fresh reminder that policy absorption of science determines the frontier of what is possible. And unless policymakers can quickly and accurately adopt science into policymaking, there will be economic costs and there will be economic setbacks. I think the last point is the most important. I don't claim any originality to it. I think Zeynep Tufekci, who writes in the New York Times, we have to appreciate that the pandemic, the novel nature of the virus means there's a lot of uncertainty. And therefore, you cannot have a single best case scenario plan for the economy. You can't expect a V-shaped recovery and put all your cards on that. You have to allow for the fact that variants can happen, and they do happen. You have to allow for the fact that human behavior will not be 100% conformist, and you have to plan for that. If you only have one scenario operating, then you're likely to get caught out at the end of the day. So I think there are general lessons about governance that COVID can teach us for all countries, not just developing countries. But I think the challenge is how do governments absorb that capacity and develop that capacity in order to stay on top of what is just the start of maybe one of the big, many more crises of this decade and beyond. Thank you.
Thank you very much, Long, for an excellent intervention, very clear narrative of the Malaysian case study. Let me just super quick things because we have other speakers, but the first one is variance. I think that's a crucial lesson coming from your country experience, coming from the pandemic in general, in particular if we look to climate change. What climate change is bringing to us is especially variance. Mm-hmm. So we need to deal with variance in a much more structured way that we're used to do in our current governance structure. That's the first thing. The second, if I can add another lesson learned from what I heard from you, probably the other one is that history matters. No, one of the great success of Malaysian policy has been in public health policies. No, despite the political problem that we're living, precisely because the country had past experiences with analogous viruses. On the other hand, the country has not been able, in your words, to adapt quickly to the new needs in terms of economic policy. Yeah. So it's been kind of trapped in a path dependency scenario because it is used to this sort of conservatory, both on the monetary and the fiscal side, and so it runs short of what was needed to do to act quick. Thank you very much. Again, I hope we'll have time to keep discussing this topic. Okay. Now, without further ado, let me leave the floor to the first of our speakers, which is connected virtually, which is with Neva Magetkla. We have been working with Neva, who is a senior economist at the TIPS in Pretoria since a long while, and the TIPS has been also one of the partners of many UNCTAD initiatives. Neva has a vast experience working with the Southern African government and the Development Bank of Southern Africa, so I guess it's another person which is in an excellent position to complement the overview that we had already started discussing on Southern Africa with the ambassador a few minutes ago. So without further ado, I leave the floor, or the screen in this case, to my friend and colleague, Neva from Pretoria.
Hi, thank you very much, and thank you for putting on this very interesting seminar. I have to say, I'm going to focus primarily on the economic issues and specifically on the implications for industrial policy. So I'm afraid it won't be as wide-ranging as the previous input, but you did hear about our public health measures from the ambassador. So to start with, I think, as you can see, the economic crisis caused by the pandemic is extraordinary. Our GDP in one quarter sank by 16% in the initial lockdown. It's since then rebounded, but it remains 1 to 2% below where it was before the pandemic. And I think that right there, in the extent of this crisis is extraordinary. In fact, I wouldn't mind a bit of a discussion about why we're not calling it a depression instead of a recession. Because I think there's a risk that we underplay how unusual this is in economic terms. A particular problem in South Africa, I don't know if it's happened elsewhere, is that the impact on inequality appeared in particular in terms of job losses, that people at the top were able to keep their jobs, they could work from home, they were valued by their companies, so their companies didn't lay them off. The really big job losses have in fact been, you can see here, this is sort of the core formal working class, and that's really who has really lost jobs. So our employment levels are still 5 to 10% below where they were before the pandemic. Informal and domestic work have pretty much bounced back. Formal workers have never lost a lot of jobs. Formal high-level workers, that is professionals and managers, never lost a lot of jobs. But we've had really big job losses in the core formal working class, which is, basically the core middle class. So that has very serious political and social implications as well. Like Malaysia, we have a fiscal crisis. The budget deficit went up to close to 10%. And like Malaysia, the response has been a shift toward austerity. You can see here there's been a planned cut in spending. At the same time, despite low interest rates nationally and globally, comparatively low nationally, compared to our history, the cost of paying for debt has risen dramatically as our debt has risen, and the National Treasury and government have tended to focus on cutting that debt without necessarily looking at the developmental outcomes. Now, you can argue that given the high cost of debt and the fact that unlike countries in the global north, we can't just issue bonds and get cheap rates for them. If we issue bonds, we're going to end up paying much more for them. The ambassador mentioned downgrading. If a developing country gets downgraded, the cost of their debt will go up and they don't have a whole lot of other options. So I think one of the issues is, we did look at other countries in Southern Africa. They've all shifted towards austerity just at the time when their economies need a stimulus. To me, what that says is we need to really think through what is there besides a classic fiscal stimulus to get these economies going, because the fact is we can't simply print money. It doesn't work that way for us. We don't have that kind of power on global markets. Which doesn't mean I think Treasury shouldn't be a little bit more relaxed on the subject. I think a really big challenge we see is around investments, that even as the economy has rebounded, employment also has rebounded to some extent, investment really has flattened out. And particularly, and this is, I think, linked to the austerity issue, government investment has fallen steadily. So there was a shift, as always when there are budget cuts, you get a shift of government spending toward consumption just because it's very hard to fire people and it's easy to cut investment projects. But now what we saw in the last quarter was that, private investment climbed 4%, public investment was flat or fell. And I think that's, a major challenge for the economy, especially because we actually have quite a low investment rate generally. So I want to talk a bit, when we looked at the responses, and I think that the previous speaker pointed out, you've got sort of public health responses, you've got welfare responses, you've got a fiscal response, and a sort of macroeconomic stimulus response, and then we have an industrial policy response. And in the paper, which Pepe, I assume, is being circulated, it really looks like when you go through it systematically, the industrial policy response is one of the weakest. So, like many countries that are, heavily dependent on mineral rents, we had quite a strong welfare response. We actually initially had a strong fiscal response, although we're cutting it back now. We had extremely strong public health response, but our industrial policy response is quite limited. And I think it's important to understand how and why that was. And I think also particularly in terms of this idea that we're trying to think through how do we learn from each other, and as Pepe said, how do we learn from our mistakes, I wanted to talk a bit about the constraints on our industrial policy. So firstly, South Africa is one of the most unequal countries in the world. This has everything to do with apartheid. So if you look at our Gini coefficient, it's most of the time the World Bank, when they publish Gini coefficients, we get to have the highest Gini coefficient almost always. Having said that, many countries don't publish a Gini coefficient at all, and that includes most petrostates. and other countries, you have to wonder about the figures they put out. Angola at one point said they had a Gini coefficient of 30, which would make them, as you can see, one of the most equitable countries in the world. I think that seems a bit improbable. So we have one of the worst reported Gini coefficients in the world. One of the main reasons is because we have high unemployment and we also have extremely unequal pay scales. And part of that, I think, and I would argue a core factor is because what apartheid did was it basically pushed most people off the land. So instead of having sort of dual income households where you have some people working on the land and then people are able to go into work in new industries, what we've always had is people who are just unemployed and survive off social grants from the state since 94. And before 94, you know, people just basically often went hungry. And so you can see here that we have, you know, this light blue is the number of people who say they're jobless. And what we have is many, many fewer people compared to other developing countries who are actually self-employed. And that's aligned with a very low level of employment in agriculture. So these things put huge pressure on industrial policy in a variety of ways. And I would argue that the biggest way is actually not around the economics in terms of suppressed demand and so on, but that the biggest problem is actually that it means every policy measure is heavily contested. So what we have is we've got a democracy where people are supposed to have equal votes and citizens have voice when it comes to policies, but an economy which is profoundly unequal. And those things necessarily lead to continual conflict over industrial policy. So it's very hard to reach any kind of agreement or push through the kind of technocratic policy they were talking about in China, or indeed ensure that kind of responsiveness to changing conditions. So I think one of the things we have to talk about is what is the political economy of industrial policy? How do we make it work? And the crisis, of course, made all of that harder because everybody is suffering. There's huge risk. And business is lobbying, firstly, to eliminate public health measures as soon as possible, at least some of them more, particularly in tourism, but also to ensure that they get bailed out rather than having, and lower taxes, rather than having funds go to support, you know, marginalized people. I mean, what's linked to our inequality is mining dependency. And I think you can see here, Southern Africa as a whole, but also South Africa, much lower manufactured goods exports, much higher mining exports, and generally lower agricultural exports than the rest of the world. So I think the idea that, and this has been true for, 30, 40 years. This is not new. This isn't a result of industrialization in Asia. Asia was always primarily, as I understand it, more reliant on agriculture, exports than Africa was, than Southern Africa and particularly South Africa. And then that in some ways made it easier to go into manufacturing. So for us to shift into manufacturing, we have this problem. It's a bit like petrostates. We've got a very strong mining economy, and that militates against it, makes it harder to develop manufacturing in a variety of ways. And what we saw as a result is, again, when it came to the industrial policy response to the pandemic, we weren't really able to come up with disruptive measures that would generate higher employment or grow manufacturing. We did manage to support PPE manufacturing. We made quite a lot of progress on that. And at the high end, as the ambassador said, we do have a few very high-level industries that we're able to get into pharmaceuticals. We have quite a strong pharmaceuticals industry. So we were able to take a lead on some of the both negotiations around and production of vaccines. But we're not able to come up with a manufacturing strategy that generates employment on a mass scale, and that means our industrialization policy doesn't have mass support, given the inequalities I was talking about. So just to conclude, sorry, Pepe, I don't know where I'm on time. We said 10 minutes, which is not a very long time.
You're doing fine. You're doing fine.
Okay, well, I'm still almost done because I wasn't sure. Firstly, that I think that if we're talking about what we can learn from the pandemic, we really, and I think this came through also clearly in the previous paper, we can't just talk about industrial policy in the abstract and what should be done. We have to be clear about the political economy and how that affects the scope of what we can do. And I would argue, particularly if we want to have democratic governments and societies, but we have unequal economies, we need to face up to that challenge and say, the real question is, how do we come up with a policy that maintains a popular support when industrialization in itself doesn't necessarily generate jobs, unless we're really careful about that? on the one hand, and on the other hand, how do we manage business? Given that there's a risk of real populist anger and you end up, I don't know if you know, but we had, for instance, massive riots in July, partially because they cut back on the welfare package to support people who lost their jobs because of the pandemic. You know, that set the economy back as well. So to act like we can just talk about industrial policy, or for that matter, fiscal or any economic policy, and ignore the political economic context is problematic. And I think the particular problem that I'm seeing in terms of this crisis is that, you know, policymakers and experts, including academics, in South Africa, what I've seen is they're not really saying what has changed with the pandemic. How do we understand the changes in the economy and in society as a result of the pandemic, and what would that mean for our industrial policy, rather than simply saying we're in a crisis, so now you really should do what I've always been saying you should do. So the proposals that we're seeing, I have to say, from both the left and the right, haven't actually changed very much. They're just using the crisis to say, now you really have to do what I've always said. And so business is saying exactly the same thing they said before the crisis, as if nothing had changed. And the same thing for labor and civil society. I do think that it does mean we need to also, what it underscores is that industrial policy is hard always, but also that we can't simply say, let's copy what, you know, the classic understanding of industrial policy is being around, you know, light manufacturing, heavy manufacturing, and then you kind of take off based on exports. It's kind of become a sort of very simplistic view of industrial policy. But things have changed since the 1950s and 60s. And I think, you know, really critical is, firstly, what does industrial policy look like in mining-dependent and highly unequal economies like South Africa? So the economies we're most like actually are in Latin America. And I think when people talk about the middle income trap, it's countries like ours that we're talking about. What would industrial policy look like? A sustainable, that is an industrial policy that is sustainable and viable politically as well as economically in a country that is dependent, that is so unequal and so successful around mining. Also, how do we think about getting into the export market for latecomers? I mean, we heard this morning that China, you know, has opened up the world to its exports, which is true. But for a country like South Africa, it means we're actually unable to compete with China. And we also depend on imports of clothing and appliances from China, and it's very hard for us to break into those markets as a result. And so how do we think about latecomers and their access to manufacturing and the development of manufacturing, given that they're competing with longstanding, you know, well-established and competent producers with the same or lower wages? And then finally, we really need to reflect on what are the new global realities as a result of the pandemic, and I have to say now, as a result of this very new war, which is clearly going to upend a lot of assumptions we had about globalization. So what we've seen the issue of overburdened supply chains. You know, our auto industry crashed again in
Neva,
July
sorry,
to September.
I have to ask you 30 seconds for
fine.
concluding, because we are running out of time.
You
Thanks.
made me so comfortable. Thought I could. Okay. That we're clearly seeing now great power competition that is going to further disrupt the globalization. And then finally, what we were talking about, we have this very high pandemic debt in much of the global south. What are innovative solutions? We can't just fall back on saying spend more when it becomes impossibly expensive for these countries. So what is possible to think about stimulus that doesn't involve just borrowing? And finally, just to flag, I do think we need to, in all of this, think about we need to think about how do we learn from others, since we can't copy them, as we said this morning. How do we then learn from each other's experience? What is a methodology that will help us learn in a way that actually comes up with better ideas for our own context, rather than saying either we copy you or we ignore you? Thank you very much.
Thanks a lot, Neva. Excellent intervention, extremely clear. And I gotta say, you touch on some points which are of critical importance whenever we discuss developing economies, but whenever we discuss the impact on the pandemic. Inequality was touched as well a bit by the ambassador. It's so critically important. One of the most critical things of this pandemic, or the clearest thing that we've been observing, is that poor people have been eaten the first. And the impact has been unequal across country, within country, across social category, across gender. So inequality is a dimension we cannot escape. And again, when we think to industrial policy without the lens of political economy, you cannot understand why certain policies are implemented, work or not work, are not implemented. And in the case of South Africa, the vicious cycle you hint at, it's extremely true and you've got to be aware of. In very unequal countries, it's very difficult to implement, to find an agreement on industrial policy. And find an agreement in implementing effective industrial policy fires against back on inequality, because you cannot, without a clean process of structural transformation accompanied by industrial policy, it's difficult to think you will be able structurally to overcome inequality problem. You don't solve inequality with fiscal redistribution, in a sense. And just to close, the importance of pragmatism. No, you mentioned it's important to see what works in the context of the quant. And this, once again, it talks to the panel this morning, what my colleague Dan Wei and Mr. Che, the Chinese ambassador here in Geneva, were mentioning. The Chinese way of saying, it doesn't matter whether the cat is white or black, but it matters that it catches mice. So it's again another important message I'd like to keep home and to stress. Now, without further ado, I leave the floor to our fourth speaker of the day, which is Ms. Liping Zhang, who is connected with us from Beijing. Liping is the Deputy Director General of the Financial Research Institute in Beijing and has a vast experience in economic policy, and especially when it comes to monetary and financial issues, having been in the past also in the Institute of Monetary Affairs in Japan and the Peterson Institute of International Economics. So without further ado, Liping, the floor is yours for a 10 minutes speech. Thank you very much.
Okay. Thank you, Chairman. Thank you. Thank UNCTAD's invitation. So my presentation is based on the paper of China's policy experience in responding to COVID-19 shock. That paper prepared by my colleague Sun Fei, Chu Xiaoyu, and me is just the paper is prepared for the UNCTAD project. This time, my presentation is, only on key economic policy responding to the COVID-19 shock in China. The first, I would like to mention some the four main challenges to Chinese economy owing to COVID-19. At the beginning of the outbreak of COVID-19, market panic intensified with the number of domestic affected cases increasing sharply. What's wrong? The second, challenge is the strict internal intervention and control measures disrupt normal economic activities, especially the lockdown, policies. And the third challenge is the uncertainty of the external environment increased with the pandemic, And the fourth is the shock of COVID-19 increased the difficulty of achieving established development targets of China. Maybe the last one is special for China. 2020 is a critical year in China because we need to realize the 13th 5-year guidelines target, and also we need to realize the target of the poverty reduction. So those 4 challenges. What's wrong? I could not use. Sorry. And to overcome those challenges and realize the targets, the economic targets, China take several economic policy actions. One is the physical policy. The second is the monetary and the financial policies, and third is employment policies. For the fiscal policy, there are four tools. One is to establish direct budgetary funds allocation mechanism. Under this mechanism, the central fiscal funds can be allocated quickly and directly to the departments using the funds. It's recorded that more than 19% of these funds being dispatched within about 20 days. About 2 trillion yuan of central government funds was placed under such mechanism in 2020. And the second tool is the tax and fee reduction. In 2020, China introduced 28 new tax and fee reduction policies in batches, including to lower the value-added tax rate, special additional reduction for personal income tax, and lower the corporation person insurance rate to reduce the burden of market entities. It's reported that China reduced the burden on market entity by more than 6 trillion yuan. The third tool is to increase expenditure on anti-epidemic and epidemic prevention. Government at various levels allocated over 200 billion yuan special funds for the procuration of COVID-19 treatment, prevention, and control materials in 2020. And the fourth tool is the subsidies to consumers and enterprises. The subsidies to consumer is mainly in the form of a voucher. Up to 8th May of 2020, more than 170 cities have issued a cumulative total of over 19 billion consumer voucher. 19 billion yuan. To the enterprises were mainly, the subsidy to enterprises were mainly by local government. Therefore, enterprises were chosen to receive subsidies with different priorities in different regions. Our monetary and financial policies include 3 aspects. One is to provide sufficient liquidity for the market. China's central bank launched more than 9 trillion yuan of monetary support measures through tools such as, reserve requirement ratio cut, medium-term lending facility, and refinancing and discounting. And the central government lowered the deposit reserve ratio 3 times in 2020 to provide long-term liquidity of the total amount is 1.75 trillion yuan. The second tool is the credit support to enterprises. Central government arranged a total 1.8 trillion yuan to support banks issue preferential loans to enterprises. And also the designated entities were allowed to postpone principal and interest repayments on their loan. The total amount of the loan is about 7.3 trillion yuan involved. The banking financial institutions are encouraged to issue inclusive small and micro credit loan. In 2020, that loan, the amount of that loan is about 3.9 trillion yuan. And the other financial support measures include financing support relating with bond market and supply of finance and credit guarantee. That's monetary and financial policy. And the third policy is employment policy. First measure is to help migrant workers to return to work smoothly through point-to-point transportation. As you know that in China, a lot of workers, migrate every year from rural area to city. So one outbreak of COVID-19, the factory need those workers come back. So the government provides such kind of policy to workers and firms. Till March 18th of 2020, total of more than 4.1 million migrant workers were transported. The second policy is about to help the graduate to find jobs. One measure is to get graduates to work for local governments. The second is to encourage graduates to engage in the startup business. And the third one is to carry out 24365 campus recruitment service. That means 24 hours, 365 days. The graduates could get campus recruitment service from this program. The third employment policy is to strengthen transfer vocational training. During the pandemic period, a lot of consumption is from offline to online. So a lot of new vocation appears. Then some local government provide subsidy funds for vocational training program for those workers.
Sorry, Liping, I have to ask you to conclude in 1 minute. Unfortunately, we're running out of time. Thank you very much.
Okay. The impact of China's policy in 4 aspects. One is that the market entity remains stable and the investment recover quickly. The second is the consumer demand and is stable and rapid adjustment of consumption pattern. The third is that import and export gradually stabilized. The fourth is the employment situation was generally stable. And the main policy experience of China's response to COVID-19 shock, I think, have 3 points I would like to share here. One is the policy were timely introduced. And the second is economic policy actions highly focus on dealing with structural issue. I would like emphasize here. One is to ensure the supply of epidemic prevention materials. The second is to ensure people's normal life by ensuring the supply of daily necessities. And third is to place special emphasis on supporting industries and companies and people badly affected by the COVID-19 shock. The third is that many response measures continue to be adopted. I just said several measures here. Thank you for your attention. So.
Thank you very much. Thank you very much, Liping, for your very clear and complete intervention. I think it was very, very important for peer country being exposed to the Chinese experience. It's the aim of all the exercise that we've been running this for years, sharing experience from China to other countries along the BRI and across these countries, of course, and in particular in the post-COVID recovery phase, in the responses to COVID-19, is again been a reference point as it has been one of the first countries to be able to put the economy back into track. So thank you very much for this, for sharing with us the experience of your country. Now, without further ado, I'm just moving to the last speaker of today, which is Mulu Ghebreyesus, who is an international consultant and has been working extensively for a lot of organizations and research centers, most notably for a lot of years cooperating with UNOMERIT in Maastricht and with the Ethiopian Policy Studies Institute, which, let me just remember, that has been one of our critical partners during these years in running this exercise. He has been published widely in different fields of development economics and also a PhD from the University of Gothenburg in Sweden. So I think, again, he's another person who can drive us in the best possible way to discuss the case of Ethiopia and the policy responses of this country after the pandemic shock. So Mulu, go ahead, the screen is yours.
Thank you very much. I would like to thank UNCTAD for inviting me to take part in this interesting project, beginning the meeting in Jakarta. And I'm happy to see the conclusion of this project at this moment. So let me go to my presentation. Well, this is the study that was concluded last September. So there could be some updates later on last 6 months, but in any way, the main messages are here. So I would like to see the Ethiopia's response to the COVID pandemic, measures, impact, and the lessons. You can hear me, right?
Yes, Mulu, we can hear you perfectly.
All right. Well, the objective of this study, as previous speakers have also mentioned, this is to see how the COVID-19 has impacted the economy at large, employment, and many other measures. So this was based on a desk review and available literature and the data of secondary sources. As we all know, the first case of COVID-19 was emerged in China. Then we see the first case in Ethiopia in about 2 months, in the 2nd of March. The COVID pandemic was emerged when Ethiopia had started to face various macroeconomic imbalances, high trade deficit, risk of debt distress, high inflation, and high unemployment. And also, I would like to mention there was, in fact, even now continuing high social unrest and conflict. So it was largely feared this can derail the unprecedented economic and social progress made in the last two decades. So in this context, let me show you some graph how this COVID COVID-19 incidents and spread was in Ethiopia. As you can see from the graph, I have updated it up to March 2022. There were about 4 peaks: August 2020, April 2021, August 2021, and since January 2022, even these days. As of September 2021, there were some 310,994, but this has increased in the last 6 months, reaching around 470,000. But of course, still the infection rate per million people or per population is much lower in comparison to most African countries. At the moment, in Ethiopia, there are 4,080 cases per million population. This is cumulative one I'm talking to, because there are a lot of recoveries in the middle. In terms of vaccination, about 23 million have been vaccinated. This is about 22% of the population, but only 4.5 million laboratory tests has been made so far out of 110 million population. This is nearly 2% or 3%, so it's much lower. Now, there were a lot of predictions made in the early 2020s how the COVID may impact the Ethiopian economy. Different studies have mentioned and reviewed in my study. Basically, it was given in different scenarios. GDP growth rate was predicted to decline by between 2% and 10%, depending on the scenario made. There was also a prediction of loss of employment, nearly 1 million up to 2.5 million. A number of predictions were also made on the other macro variables like exchange rate depreciation, export decline, FDI decline, remittance to be shrink, and high inflation. But what had actually happened, my analysis was basically to show what was the actual impact. I rely on data up to the mid 2021, but of course the official data, annual data, only recovered 2019 and 20 in physical year in Ethiopia. That counts from July to June. So basically, GDP growth was declined from around 9% to 6%. This was a 3 percentage points decline in comparison to the earliest year. Most negatively affected sectors were the service and the industry. For example, service declined from 11% growth to 5.3%. Industry it declined by 3 percentage points. In contrast, agriculture growth slightly increased from 3.8% to 4.3%. There are some reasons for the agricultural growth increase due to some seasonal or fiscal year counting. I will get back later on this issue. Job loss was basically moderate, but of course we have no official data, but some limited surveys show about 8% lost their jobs. Particularly affected were the self-employed and working as casual laborers. Sector-wise, the most affected sectors was hospitality and trade sectors, as well as construction. In terms of international trade, it was feared to be declined, but fortunately there were some improvements. I will come to why this happened. There were reductions in trade deficit. For example, overall goods export from Ethiopia in the year 2019-20 grew by 12%. This was largely due to high rise in gold export earnings, but at the same time, import bill was fell by 8%, again due to a drop in fuel imports. So in total, it helped to reduce the trade deficit. We see also a reduction in deficit in the account balance. this was basically even export of services had declined and import of services also declined, but the decline in import service was higher than the decline in export services. The adverse effects were mainly reflected in a decline of private and official transfers and foreign direct investment. Private remittance dropped by 90%, official transfer by 27%, and the FDI dropped by 20%. Still, there is a decline in FDI even this year. Official transfer also continued to decline, but there is some rebound in terms of remittance. We have also observed adverse effect in fast exchange rate depreciation, and inflation is also soaring. Let me go to the summary and the key lessons. I would like to focus here also looking on those policy and non-policy issues. An obvious explanation for the moderate economic impact in Ethiopia is the fact that the spread of the COVID-19 pandemic in Ethiopia has so far been low. As I said before, there are only 4,080 people per 1 million people infected. Low spread of COVID means economic activities were less affected. What are the likely reasons for the low infection rate? Of course, the majority of people live in the rural area in a dispersely way of life. So the infection rate and the spread rate will be obviously low in the rural area who are living dispersely. The response of the government was basically quick, and coordination among different public organizations fairly good. But there were also a lot of limitations in terms of enforcement. Other positive issue that we can see is the prevention-based primary public health care infrastructure and health extension system in the country has also helped in the fight against the COVID pandemic. We have also additional factors why the economic impact of COVID-19 in Ethiopia was not as severe as it was forecasted. The impact of COVID pandemic took place largely in the second half of Ethiopian fiscal year. So we may see the impact a bit later, but my analysis also looking this year growth rate, it is still 6%. So in comparison to many other countries, this is particularly a good performance. Second, the Ethiopian economy is relatively less exposed to global shocks in comparison to the sub-Saharan African average. The Ethiopian trade to GDP ratio in 2020 was 24%. It's more or less half of the sub-Saharan Africa average. At a policy sphere or in a policy aspect, the country has pursued partial rather than full lockdowns, unlike to many other countries. This means it has encouraged production and other economic activities. So even during the crisis. Like the other speakers say, the government has introduced several relief measures and stimulus packages, fiscal tax relief and supports, monetary initiatives like liquidity to banks and small businesses, and there are also sector-specific interventions. The government also encouraged businesses to design innovative strategies and exploit the emerging opportunities by the COVID-19. A good example is the Ethiopian Airlines shifting its business from passenger to cargo business. Manufacturers in the industrial parks were also encouraged to produce medical supplies and equipment to fight COVID-19, as we can see. The government also implemented different measures to ease the pressure on vulnerable groups, restricting workers' layoff, subsidizing businesses to retain their work, and also easing the importation of staple foods to address the food price hike. But even if this is a good news, but there are some cavities. Disentangling the COVID impact on the economy is particularly difficult amid the ongoing civil war in Ethiopia. the ongoing conflict is also believed to have hampered the fight against COVID-19. As we can see, it's booming the spread again, and the officials are busy dealing with the ongoing conflict. So there are some enforcement and also a focus problem here. The COVID, as I said, is far from over, and in fact, it's showing a shocking increase in the last 6 months, like 50% increase in cases and 59% increase in deaths. So this is shocking for me that the officials should look at. Weak testing facilities and low vaccination rate may also jeopardize the fighting against COVID. Again, the officials need to refocus their efforts towards addressing the new trends. Thank you very much. This is what I have to say.
Thank you very much, Mulu, for your presentation. I would say that very nicely complete the spectrum of country experiences, and very nicely concluded also because it put again once again under the attention the fact, and highlight the fact that countries are very different and have been experiencing even the COVID shock, which has been a common shock in a very different way. No? Mulu was just discussing with us as the country was just mildly hit by the shock, at least in the first time, because of the specific condition of the country and because understanding the vulnerabilities when it matters to global shock, individual and idiosyncratic vulnerability matters a lot. Now, in the case of Ethiopia, it was the share of rural population which somehow isolated them from the diffusion of the virus at the incept, and in economic terms, somehow independence and a more distant position with respect to the global shock somehow insulated the country. Of course, it also stresses the fact that this pandemic, and one of the most difficult things of this pandemic, has been the way in which it has been moving from one continent to the other, from one country to the others, and now the last data that Mulu was discussing with us are less optimistic in terms of the development of the pandemic in Ethiopia. Just few words to conclude because we are well beyond the time, so unfortunately we will not have time to discuss. Many topics have been touched, other not. There was one interesting question from the floor in the chat about the small and medium enterprises, which have already a very short life in many developing countries, and the pandemic seems to have accelerated this short life for these countries. I think, I'm sure we will have time to work on this issue and to have other events maybe focusing on specific issue like this one. We have learned, I guess, a lot of things. We have touched a lot of topics. I think the narrative that my friend Xiaorong, which is next to me, is very interesting. The fact that for many countries, not only for Malaysia, this crisis was not a single crisis. We had an health emergency, we have had an economic emergency. In many countries, this triggered the political crisis rather than being predated by so, as in the case of Malaysia. I think we have we have offered a clear spectrum of policy, which of course, which of these should be better or worse, depending on the specific vulnerability of the country. I think we have also had the possibility with discussing, especially with the ambassador, with Richard and the SG as well this morning, our Secretary General, to discuss what are the main fragilities in the global architecture, because one thing are the domestic policy, but to employ the right domestic policy and to enforce this policy, we need also policy space, which in many cases, in a globalized world economy in which we live, depends on the multilateral context in which we live. Most importantly, I think that in the session of today, and what more generally, the COVID has taught us is that a global shock like a pandemic, and like in the future in the present, the climate emergency, and of course, without forgetting the risk of a generalized war as the situation deteriorating between Ukraine and Russia is somehow suggesting, to face this problem we need cooperation. Without global cooperation, without cooperation among developing countries and between developing countries, more advanced economies, these problems cannot be solved. So I think that somehow the lesson that we learned, and I would like to close with a personal observation as a staff of the United Nations and of UNCTAD in particular, is that the work that we are doing to strengthen South-South cooperation on many respects, again, in public health, in economics, in politics, in global arena and in more regional arena, I think is more important than ever, and that's why I think we can reaffirm our willingness to continue working on the platform that we created for the BRI countries during the initiative that my friend Away was presenting to you this morning, and more in general, as UNCTAD, we will continue putting all the effort that we can in working for further cooperation and integration among developing countries, as again is in our courts and is part of our core mandate since 1964. So thank you very much again for everybody for participating physically and virtually, and for those of us physically here, we will have a cocktail at 4 p.m. by the Snake Bar. Unfortunately, this cannot be shared to our virtual participants. We will think some creative solution for the next time, and we will recover here for our meeting tomorrow morning at 10 a.m. Thank you very much to everybody.